Thank you everyone for joining us here this evening for our free food for the mind. Why is it important, or why is it important to wear the mask? And I brought my own prop here tonight. Can you hear me through the mask, everyone? These are on top of mind for everyone, and we are very lucky to have one of our very own faculty members here this evening. We will be recording the session, so you can go back and watch it at a later time. And I also want to give a plug for our December 17th Free Food for the Mind. It is why is it important to understand the Black Lives Matter movement, and that will be on December 17th, as I said, from 5 to 6 p.m. But here we are this evening, as I said, social distancing, masking up, that's all part of our vernacular now. And it's been part of that for the past 8 to 9 months. And we are very lucky this evening to have with us registered nurse Ruby Roth. She is an instructor in the Department of Nursing, and she has been working inpatient, outpatient, and educational settings in the Rock for about 7 years. Her focus is cardiac intensive care and improving chronic illness outcomes through focused education. She's a proud Brockport alum, earning her master's in nursing education in 2018. And she started teaching in the college in 2019. Must be they liked you a lot. They hired you right after you got done. So as I said, we're very lucky to have Ruby Roth with us here tonight. And Ruby, the show is yours. And just one housekeeping item, as I said, we have a small group here tonight. And I know Ruby's going to want to take some questions, but if you could keep your phone on mute when you are not asking a question. And also feel free to put your camera on, because Ruby's a faculty member. She likes to see smiling faces when she's teaching. So Ruby, back to you.
All right, thank you everybody for joining. And we'll go ahead and get started. I am going to share my screen with you so you can see my slides. But at any point, feel free to interrupt. You can either speak up or you can type in the chat box if you feel comfortable doing so. I can see the chat box when I'm sharing my screen with you. And this is going to be very casual. So if you have questions, please feel free to interrupt me. Or if you'd like something re-clarified, go right ahead. I'm more than happy to answer that. And we'll go ahead and get started. So tonight we're talking about the usefulness, the effectiveness of masking for COVID-19 and how exactly does it help? How do you evaluate a tool such as a mask in terms of COVID protection and protecting others? This was a really interesting topic for me to go through because as much as we hear about COVID all the time, all of these details don't always necessarily get covered. So it was a lot more learning and understanding why it is what we recommend what it is. So as you guys probably are well aware, COVID-19 is a airborne respiratory illness. It is in the coronavirus family. So for those of you that don't know, the coronavirus family actually makes up the common cold. But what is different about COVID-19 is a novel virus, meaning that it presents with new symptoms that we haven't necessarily seen in the past. We've seen similar ones to COVID-19, but not to the extent maybe in severity or transmission or the amount of contagiousness that it has. Primarily, coronavirus causes respiratory symptoms. So when you think about when you have a cold, you have a runny nose, you have sinus pressure, cough, sometimes congestion, things like that. What we see in coronavirus and COVID-19 specifically is that the severity of that is a lot higher, which is why we have these increased rates of hospitalization, and it's a little more dangerous. So typically what we see contributing to the spread of COVID is droplets and particles. So this picture on my right here is a zoomed up microscopic picture to illuminate for you guys when you sneeze how much droplets go out into the air. And everybody is doing that at the same time. And we're all breathing that in, and that is how COVID gets spread. So that is kind of to start leading into the topic of why a mask could be beneficial in this case, because we basically want to stop that cloud from happening and having other people breathe in that cloud of droplets. You can't necessarily see droplets, even though sometimes you can, but you know, it's kind of more rare. A lot of the times you're not able to see or visualize exactly where a person just sneezed when you walk through that cloud or something like that. Other ways that we've seen that it has been spread are coughing, talking, breathing, and singing, which was a new surprising one for me coming into this pandemic. I mean, there are a lot of surprises coming into the pandemic, but that was one. And then you can also contaminate yourself with COVID-19 droplets if you touch a surface that had droplets on it and then touch your own face. When you do that, you're actually creating a contact point from which you are breathing in the droplets. So that's why it's important, and we emphasize hand washing as well. So some things, this is from the CDC website for making a difference during the COVID-19 pandemic and stopping the spread. So some of these we're going to talk about more having to do with the masking, social distancing, and PPE, personal protective equipment. Washing your hands remains important. We're just not really talking about that too much tonight, but if anybody has questions on that, more than happy to answer them. Food safety guidelines and donating blood and plasma are not something we're going to really talk about. And then fraudulent COVID-19 testing, that could probably be a webinar in itself, but we're not going to talk about that tonight. So the big important things to take away from this are masking. We're going to go in detail on that, social distancing, and the different types of masks and what makes a good mask or a good facial barrier for you. So there are a number, as we've seen, of different varieties of face coverings and masks that are out there. What I really want everyone to take away from this is how would you evaluate if a mask is a good one for you, if it's something that's going to help actually protect you or protect someone, one of your loved ones, versus something that simply is meeting the criterion but doesn't necessarily actually provide any benefit. So first and foremost, we talk about masks and face coverings. We usually are considering that proper wear would be covering both the mouth and the nose. It has to fit well and have these certain criteria in order to protect yourself and to protect others that are within your social circle, or maybe you're at the grocery store, different scenarios. Goodness of fit is very important as well. If you don't have a good fit, the mask itself or the face covering itself cannot provide you with any sort of protection because of the fact that there isn't actually a block happening. It's just air being redirected. And it's not a substitute for social distancing. So currently guidelines are that if you are unable to maintain a distance of more than 6 feet apart, you need to be wearing a mask. However, in certain social settings, it would be beneficial to continue wearing that mask even at 6 feet or more distance, which is really irritating because, you know, it's hard to understand each other. But unfortunately, there is no perfect solution to prevent every single possibility out there. So when we talk about goodness of fit, we're going to get into a little bit of why this gentleman on the right's picture isn't actually a very useful face mask or covering, as much as these are commonly seen in the grocery store, in different areas. This actually does not provide a lot of protection for yourself or for others that you're around. So it's much better to actually have a mask versus a face covering. So why a mask? What does a mask do that prevents or helps with disease stopping transmission of it? So most importantly, the mask provides a barrier for droplets. And you guys can see that there's a little asterisk there. That barrier has to remain intact and has to have a good fit in order for it to work. We're going to talk a little bit about how we would determine a good fit and what type of materials would make a good barrier. It also provides physical barriers for touching your nose and mouth. So one of the things that was most interesting about when this whole pandemic started was the amount of teaching that had to be done in terms of teaching yourself how not to touch your face. As silly as that sounds, we probably touch our faces on average about 30 times in a minute without even realizing it. And a lot of that actually just comes out of habit. When we start throwing on something like a mask onto our face, the mask is moving, maybe it's itchy, it doesn't fit right. All of those times you're making contact points with your face. When we talk about contamination, every time that your hands have touched a surface that wasn't considered clean, as in you didn't directly clean it, then you are contaminating your hands and then touching your face. It's a very easy thing to do. It's something that we struggle with all the time. And putting on a mask provides a physical barrier, a reminder not to touch those areas until your hands are clean. Now, of course, in terms of recommendations, masks have been recommended to protect the public from a COVID positive individual and also to provide self-protection. Now, we're going to get into a little bit of detail as how that works. Really the best and most ideal situation is that a COVID positive individual, even if they didn't have symptoms, was wearing a mask and you were wearing a mask, and therefore your chances of disease transmission are very low. However, unfortunately, that's not always the case. And that's what we're seeing with an increase in rising cases in our area right now, is mostly due to the fact that those protocols and recommendations haven't been followed. So this is showing the risk of disease transmission when we apply the mask for both people or just for one. So on the left side, we have our COVID-19 carrier. When both the COVID-19 carrier and the healthy person wear a mask, they have a low risk of transmission, even if they break that 6 feet of distance. Okay, there's a barrier on both sides of that, a barrier for the healthy person that's breathing in and a barrier for the COVID-19 person that is breathing out. A medium risk is when only one is wearing a mask. So either the person that is healthy or the person that has COVID-19. If one of those is wearing a mask, then typically you would see that medium risk happens because one person is providing some sort of filtration and pulling out some of those droplets from the air. High risk is when neither person is wearing a mask. That means that they're breathing in essentially the same air. There's no filtration, there's no particle catching action happening at any point. Therefore, they're at a higher risk of contaminating themselves, contaminating somebody else, or contracting COVID-19. Now, when we talk about masks, there's a whole bunch of different types of masks. Now, in general, the recommendation for the general public is to wear a cloth mask. And the reason being that we want to preserve what surgical masks and medical equipment that we have for healthcare workers. In healthcare, we do have a number of different masks that we wear. Surgical masks are really your bread and butter type of masks. You see these worn during flu season a lot for healthcare workers. And in general, they are available to the public. So you can order them. I've seen them on Amazon. I've seen them in stores. Of course, now they're always in stores. A surgical mask is usually made out of some type of manufactured man-made materials that provide some filtration to it. Still important that you maintain a fit for that, because otherwise it does not work effectively. The same kind of concept goes for a cloth mask. So a cloth mask can be made from a variety of different materials. Those materials vary, and the effectiveness of them also varies with those materials. We're going to talk a little bit about what materials are currently being recommended for a cloth mask and what materials probably will not provide much help, support, or be effective. Other masks are N95s and PAPRs. Now, some people may laugh at seeing the PAPRs, but I've actually seen a lot of people out in public with these. A PAPR is a positive airway, positive pressure filtration system. It's actually a head-worn contraption. And these provide separate filtration of air that person breathes in, so they don't have any sort of contamination from other people because they're breathing in this little hood. An N95, some people may have seen this, they can be used in some other areas besides healthcare too, because their filtration capacity is much higher. They're able to filter out really fine particles, which is why they're a preferred thing for respiratory illnesses, because respiratory illnesses tend to be really fine particles. An N95 and a PAPR also require proper fitting of them in order for them to be effective. So once again, it is very essential that you know how to put it on properly and make sure that it fits properly, which is why we do testing for most of these more advanced droplet filtration masks, the PAPRs and the N95s. We do fit testing every year to make sure that they fit our face adequately in healthcare. And likewise, it would be beneficial if this is the type that you're wearing, that you also get tested to make sure that it is correct seal for you. So what makes a good mask? So a mask, to be a good mask that is going to filter out particles that would help prevent disease transmission, should have a good fit that adapts to your specific face. So what fits my face may not necessarily fit your face. It has multiple layers to it. I have seen some masks like this that have a disposable filter in it that can be changed out or even reused and washed. So that addition of layers provides more areas that are filtering out particles, which is why that it can be more effective. The materials also matter. We found that cotton-based fabrics and nylon provide a very good barrier for filtering out particles in comparison to other materials. This is pertaining specifically to cloth masks. Now, with surgical masks, there are different materials that are utilized in them, but they are synthetic. Therefore, they're kind of designed to be particle filtering materials. Likewise, if moisture happens, so cotton as a fabric tends to kind of remain moist. If a moisture barrier is compromised, so your mask becomes moist either from your breath, maybe it's raining, things like that, that barrier and filtering capacity significantly decreases when wet. So if your mask is moist, you need to change it. Tightly woven fabrics, such as nylon fabrics, can be very useful in terms of filtering out particles. It also needs to be breathable, okay? So I don't want you guys suffocating yourselves trying to breathe through many, many layers of different materials, but it is important that it has a certain integrity to it. One of the ways that you can test that is if the fabric mask that you have, if you hold it up to light and can see light through it, it is not dense enough. You need to have it thicker than that. And one of the ways that you can do that is doing the disposable filters. Another way would just simply be to add another layer. And yes, you can't usually see through the Brockport ones. I did check. And filter pockets. So right around when the pandemic started, a lot of different patterns were floating around, and some of them had a filter pocket built in and some of them didn't. It is beneficial if you can have a filter pocket put in, because then you can add an extra layer through that, say a nylon layer, something like that, to allow for more capacity for filtering. However, doesn't necessarily mean that if your mask doesn't have that, that it's an inadequate mask. So if we compare, whoops, I keep doing that, I'm so sorry. If we compare materials, cloth masks and surgical masks have different rates of effectiveness. So surgical masks remain up to 90% effective when worn properly. So it is proper fit that makes it that 90% effective. The same hygiene standards apply for both. So it is important that you wash your hands before you put on your mask and before you take off your mask, so you don't risk the chance of contaminating your own self with dirty hands, okay? You should use a surgical mask when available. However, in a shortage, it is essential to leave those masks for the people that have to take care of COVID-19 infected individuals in hospital settings, in urgent care settings, and things like that. They provide more protection. If you're not able to social distance, ideally you would have a surgical mask. However, in the option that you are in the general public and you are able to maintain that 6 feet of distance from other people and wear a mask, it is best for you to continue with a cloth mask. Cloth masks, now they range in effectiveness. They can range anywhere from 35% to 75% effective. And that really comes down to the materials. So a material that is cotton-based with a nylon barrier added in is up to 75% effective in comparison to a see-through fabric that maybe just covers your nose and mouth. Again, proper fit is essential. Now, there's a lot of different ways that you can ensure a proper fit with a cloth mask. Some of the ways that I've found were adding in little bars to the top of the mask so it can fit around your nose. You also want to make sure that it covers completely your chin, but it actually hugs your chin. You don't want it to be draping over your chin. You want that proper fit both on the nose and the mouth and the chin in order to make sure that it is providing the amount of, the best amount of filtration. Efficiency, again, depends on materials like we talked about. Test your mask, see if it is see-through, see if it is fitting your specific face. It is possible that you may need an adjustment. So sometimes what we can do is get elastic bands or different materials to be added on to provide that better fit for you. It can be more effective with additional barriers like nylon. When I was looking this up and researching this, it was interesting. I saw people that put pantyhose tied around their mouths. Now, I wouldn't recommend that. It's a very odd picture, but you can kind of see how you could potentially find a nylon-based material and add that into your mask. However, I don't know that people would understand what you were doing with just the pantyhose. That was strange. Again, cotton materials are ideal. So if you are able to look up, if you bought a mask, like a store-bought one that was cloth made, see what material it's made out of. If it's not cotton-based, it doesn't necessarily mean that it's an adequate mask, but test it, see how it fits. If it fits you properly, if it's not see-through, if it has the option to add in an extra barrier, go for it. There we go. All right, so our key points of the masks. So if either material is soiled or moist, it is no longer protective, and that applies for every single one of the masks that we talked about, okay? So if you have a moist N95, a moist surgical mask, a moist cloth mask, it is not going to be effective in protecting you against COVID-19 and or any other droplets. It simply does not have that capacity anymore. Disposable masks should be treated as disposable masks, okay? So what I mean by that is that if you purchase disposable paper surgical masks, they need to be disposed of. You cannot keep these for an indefinite amount of time and assume that they are going to act at the same amount of efficacy in terms of filtering out different particles. Ensuring the fit on a cloth mask is actually much more difficult. So test it before you use it in public. And again, this goes back to adjusting the nose to fit snugly around your nose and snugly around your chin. It should not be gaping. You should not have holes or big open areas of it. It should fit nice and snug around your face and feel comfortable. It shouldn't be suffocating you. Masks are most effective when both parties are wearing one. And materials to promote proper fit are beneficial. So adding in a nose bar or adjusting elastic bands to better fit around. That will provide you with the most efficiency, the 75%, which is what we're aiming for with all of our masks at least. If someone has symptoms, they need to be wearing a mask around other people to prevent spread, because even if the other people are not wearing a mask, if the symptomatic person is wearing a mask, they lower that risk of transmission significantly. And wearing a mask for you, even if others aren't, protects you as well. So ideally, the perfect situation that we looked at is both people are wearing a mask, regardless if one has symptoms or not. But if not, protect yourself. Now, one of the ways that we want to assure that our mask fits well, all right? So we're going to apply it. We're going to conform the nose bridge to the face and ensure that our chin is snugly covered and not gaping. After you've done this point, you want to move your head to side and your neck up and down. And what you're doing there is ensuring that when you do those movements of your head and face, that you don't notice any gaping, any changes in the fit of your mask, or that it simply is uncomfortable to do that. So it shouldn't be suffocating you to the point where you feel like you can't move your head. Test your materials. Can you see light through them? If you can, then that's probably not a good sign. Add in another filter or another layer, or get a different mask. And if you can, use additional materials to increase the efficiency. Now, I do have a quick video that we're gonna watch from some former students that really had a lot of fun making it. So hopefully you guys will like it too. Now, mask etiquette. Where basically the moral of this story and slide is not to do what this guy did. Okay, so he takes the hand sanitizer and then he proceeds to rub his hair and then walk away. So he did nothing in terms of cleaning his hands, which would not be ideal. You want to make sure that you actually clean your hands. So wash your hands either with soap and water, minimum of 20 seconds. And you're going to, if you use hand sanitizer, you're going to try to cover all areas. Make sure you get the areas that are commonly missed. So fingertips, in between your fingers, things like that. Make sure that the alcohol is completely dry from the hand sanitizer and that your hands are completely dry from washing your hands. Apply your mask, fit it to your face. Again, do your testing, move your head around, make sure that it has a nice snug fit. Wash your hands again. And when in doubt, if you're not sure if your hands are clean, contaminated, dirty, wash your hands, just be safe. All right, so this video They really like their puppies, so they included a picture of them too. So as you guys can see, they obviously really went for the drama award of the year, but they had a lot of fun making that video. And that actually wound up happening prior to COVID-19. So I was thought it was really funny that then we wound up using the video later on. But in general, as you guys could see from the video, you know, you wash your hands before you put your mask on, you make your adjustments, and then anytime after that, if you want to touch your face, wash your hands. And then after touching your face, wash your hands. Again, just to reiterate, if anything, just make sure you're wearing a mask. That's the biggest thing that will help you and be effective in terms of preventing COVID-19 transmission. And now I'd like to open the floor for anybody if they have questions.
You want to unshare your screen, Ruby, and then people can feel free to turn your cameras on and turn your mute button off, and feel free to fire away. Thank you, Ruby.
Yeah.
I thought it was totally excellent. Outstanding presentation.
Thank you.
Somebody going to start off with a question? I have a couple questions, but we want to let people fire away first.
Yeah, any questions, please?
Okay, I'll go ahead. You know, as nurses and nursing faculty, you look at it obviously through the health lens, but just back to your point with the legal aspect of, as long as you have something on your face, that counts as you being covered, versus the healthy aspect. And I do believe in science, so put that out there. But how do you, how have you wrestled with that, and how is it as a professional? Talk about that a little bit.
It's definitely probably the most thing is to see people that kind of just disregard it to fill the requirement to enter a store or something like that. It depends on the situation, if applicable. So in a hospital setting where you've got immunocompromised patients and possibly the same nurse or healthcare professional seeing multiple people, it is essential that you speak up and say something. However, in certain settings, like would I want to argue with somebody at Wegmans about whether or not their face thing is actually effective? No, the best option in that case would be to wear a proper mask yourself and protect yourself as much as possible. And then of course, maintain that 6 feet of social distancing. But it certainly is frustrating because when we look at the data and the numbers in terms of what actually works, it's obvious that wearing just a simple face covering that doesn't necessarily fit your face isn't going to do anything effective in comparison to wearing something that does fit your face and is molded to you. Does that answer your question?
It does. And like I said, it must be nerve-wracking for you to see that and know with what you do. And so.
Thank you.
How do you rate the mask, Brockports Mask, the black one?
I think it's a really good one. It fits my face really well. I don't know. I think I kind of have a smaller head in comparison to some people. So it's possible that there are people out there that it will not fit, and that's totally fine. You have to make some adjustments to what fits you personally. But I think they're breathable. They're very easy to maintain. They're washable. I think that in terms of moisture, they really don't get too moist, at least in my experience, which is really good as well, because that means you can wear it the entire time you're in a store or something like that and not have to worry about the integrity of it. But again, it comes down to fit, and if it fits you individually. If it doesn't, that's okay, then just find a different one. And I did, after reading all the research and data on it, I did hold it up to the lights and everything in all different places in my house, and I couldn't see through it. So I'd say that was a pretty but they don't have a material list on it of what it's made of. So I can't tell you whether it's fully cotton, but I'm pretty sure it's got some sort of synthetic materials. I don't think it's cotton.
It's polyester. I just checked on the tag, but
okay.
But you can't see through it.
I didn't have a tag on mine.
This is a little off topic, but we were talking about this prior to coming online here tonight, just to talk about the nursing students and what they're facing with some trouble with their clinicals, and then also just what's the morale. I mean, this is never been seen before when teaching nurses and some of the struggles that we see our nurses having in the hospitals. How has that been as a faculty member and as a practitioner as well?
I mean, it's hard for students. I think everybody is doing an excellent job in trying to be flexible, but just because you're flexible doesn't mean that you don't get frustrated. And we have to remember that human aspect of that it's okay to be upset that this wasn't the experience that you pictured, or it's okay to be scared. You're going into a field where you're probably going to be dealing with this directly, and it wasn't something that they anticipated. I have seen some students that, they're very gung-ho, put me on the front line, I want to go. And then I've seen other students that are a bit more reserved. And I think that really comes down to comfort levels with taking care of things like infectious diseases. And it's certainly something that I'm sure when they started nursing school never pictured happening. So now they're kind of in a situation where they have to take on a lot more than they probably initially planned for. Everyone is doing an amazing job in clinical. They're being very understanding when protocols change. Multiple times we've had to make adjustments throughout the semester to accommodate either a student whose roommate or family member who they were with over the weekend got COVID, and then they had to miss some weeks of clinical to maintain that 14-day quarantine. And it's definitely been a wild ride, and I'm sure it's going to continue to be a little bit of a wild ride, at least for a while. But I think the students have really done an amazing job in terms of really committing to their education, to committing to this field, and really putting forth their best effort, educating themselves and keeping everybody safe to the best of their ability.
What's your thought on wearing a mask outside?
Just outside, but not around people?
Well, say you're walking the dog and there are others that across the street. So, I just want to know what's appropriate for outside walking.
That's a really good question. So if you're not able to maintain really 6 feet or more of distance, you need to be wearing a mask. I'm so sorry, my dog is wagging her tail. Usually what I do, and maybe my neighbors may think I'm a little strange for this, but if somebody's coming and I'm walking like my dogs or something like that, I'll just cross the street to the other side. And it's nothing personal against them. I'll still wave hi to them if I don't have a mask. If I'm at a park or somewhere where I know that I'm going to encounter people, I will wear a mask. And that would be a recommendation, just because even though it's for such a short amount of time, if somebody were to cough or sneeze and you walk directly into that, if you have a mask on, you're much more protected than if you didn't.
Okay, so it's basically anytime you're outside of the house, wear a mask?
If none able to maintain a distance between other people. So if you are able to cross the street and remain on the other side of the street until that person is out of your pathway, then you don't have to, but it's certainly beneficial in settings where you're going to be crossing paths with a lot of people frequently.
Okay, thank you.
You're welcome. Any other questions?
Ruby, oh, sorry, go ahead.
Just real quick, do you think this will reduce the common colds and stuff? There's a lot of people out there sneezing, whether it's allergies or whatever. Do you think this will help minimize cold cross-contamination?
That's a really interesting question, and I have put a lot of thought into that because, as you guys probably know, flu season is right about now in upstate New York. We usually see flu start to spike around this time of year. And same thing with the cold virus. So coronaviruses usually spike around this time of year. We see a lot more cases of both of those in the late winter months and early winter months of the year. So I don't think there's enough data yet to really say whether or not it's going to decrease it, but I would not be surprised if people, the general public, continues to wear masks and use hand sanitizer when they're out and try to limit social interactions. I wouldn't be surprised if those rates remain low for this year. However, past this year and beyond, I can't really say, just because I don't know what the next year will bring in terms of COVID, in terms of what other respiratory diseases will be floating around. Hopefully none, but it's not a perfect world.
Thank you.
You're welcome. Any other questions?
I had another one, Ruby. Sorry. I like to ask
Sure, go ahead.
questions. The surfaces, and I think maybe personally, maybe I've gotten more lax with surfaces, but you still talked about the need to continue to wash hands after you touch surfaces, because maybe there's been conflicting reports about how long it lives on surfaces, but that's still best practice to make sure that you're not, when you're touching anything in public or in Wegmans or anything else, is just make sure you keep washing your hands.
Yes, absolutely. So there is a lot of debate on what surfaces COVID lives on the longest, and what is actually a risk for disease transmission. But as a general rule of thumb, if you yourself did not clean that product before touching it, so say you clean your cart, say you clean your cell phone, say you clean the basket that you carry in the grocery store. If you didn't yourself clean that, just assume that it's dirty and treat it as such. Wash your hands versus taking the risk of compromising your own health by touching something contaminated. It is hard to say, I mean, I can't imagine that COVID lives particularly long on lemons or something like that, but it's better to just be safe than sorry, and hand washing with a hand sanitizer only takes a few seconds. So it's much better to just be careful.
Do you have any thoughts on skincare with the alcohol so drying and multiple washing in this type of weather? Do you have any good skin care recommendations?
That is a really great question too. So I would definitely recommend, if you don't have already, get some hand cream or lotions and keep that in your car. So my current setup, I have a bottle of hand sanitizer, I have a bottle of lotion. After I wash my hands, after doing whatever it was I was doing in public, I can use lotion. Definitely, if your skin can tolerate it, try to do something that has some really good thick oils, especially this time of year. We get lots of really dry skin.
Right.
Yeah, absolutely. I don't have anything specific, like I don't have a magic hand cream, unfortunately, that works, but I like a lot of very heavily oil-based ones, the ones that you really have to kind of like emulsify in your hands and then let them soak. I find that those work best. In the hospital, what we do as nurses when we're very dry-handed, we actually will just clean our hands and then take lotion, then put gloves on, and then sit with our gloves on for a little while. But you don't have time to do that right now because we're so crazy busy there.
It doesn't minimize the effect of the alcohol?
As long as you are in a clean place, so you're not touching something contaminated. So that's kind of why it's in my car, because my car is clean, so to speak. I wash my hands and then I touch anything else in my car. So at home, or in your car, but I would not take it into the grocery store with you and do it there. I would wait till you got back to your car, your hands are clean, and then you can proceed with your hand lotion.
Okay.
To maintain.
Thank you.
Yeah, you're welcome.
So I just put in the chat here. If anyone has any other questions, feel free to ask. But for logging in tonight and listening to Ruby, we're going to send you a free Brockport mask tonight. How apropos, right? We'll send you a Brockport mask. So if you would like a mask, I know some of you may have them, just simply email, but Betsy's email, Betsy from our office. Wave Betsy. That's Betsy. Just send Betsy an email and we'll make sure we get a mask out to you. So any other questions for Ruby?
No, thank you very much. It was wonderful.
Thank you. It was a pleasure getting to talk with all of you tonight. I really enjoyed it. Thank you for having me.
Thank you. Stay well, everyone.
You are a great teacher.
Oh, thank you.
Thanks everyone for joining us, and be well, be safe out there. As we know, we're going to see another tough turn, but now we know what to do to protect ourselves, and we appreciate Ruby taking the time tonight to share her expertise. So good night, everyone.
Thank you. Good night.